Diabetic ketoacidosis, often referred to as DKA, is a serious condition that results from a combination of high blood sugar levels, the presence of ketones, and metabolic acidosis. Precipitating factors. There are 8 factors, often referred to as the 8 I's, that can contribute to the onset of DKA. These include factors like not adhering to insulin treatment, infections, heart attacks, intoxication, such as excessive alcohol consumption, inflammation, like pancreatitis, ischemia, such as a stroke, and iatrogenic causes, such as the use of steroids. The initial presentation of type 1 diabetes mellitus can involve these factors. Diagnostic investigations for DKA include checking serum glucose levels and electrolytes, including serum bicarbonate. An important value to consider is the anion gap, which can help determine the severity of the condition. Additionally, measuring beta-hydroxybutyrate and checking for ketones in the urine are part of the diagnostic process. Monitoring. When managing DKA, it's important to monitor the patient's condition closely. This involves focusing on the patient's airway, breathing, and circulation, moving them to a monitored setting, and considering the use of an arterial line for frequent blood withdrawal and Foley's catheter for monitoring. Vital signs such as heart rate and blood pressure need to be checked regularly, along with continuous glucose monitoring and electrolyte levels. The management of DKA includes replacing potassium based on the blood levels. Insulin infusion is initiated when potassium levels are above 5 millimoles per liter. Fluid resuscitation is also important, with careful administration to avoid complications in patients with congestive heart failure or kidney issues. Intravenous insulin is administered to help control blood sugar levels, and the dosages are adjusted based on the anion gap. Bicarbonate administration is considered only if the blood pH is critically low. Monitoring serum osmolality and sodium correction should be done gradually to prevent cerebral edema. Identifying and treating the precipitating factors that led to DKA is crucial for successful management. Transition to subcutaneous insulin. Once the patient's condition improves, they can transition from intravenous insulin to subcutaneous insulin, provided certain criteria are met, such as the closure of the anion gap, lower serum glucose levels, and the patient's ability to tolerate oral intake. In managing diabetic ketoacidosis, DKA, think of the 6 replacement for effective treatment. 1. Reinforce antibiotics if there's an infection present. Addressing infections promptly is vital. 2. Restore fluids to correct the severe volume depletion. Begin with a fluid bolus and continue with steady fluid administration. 3. Replace potassium levels to stabilize the patient's electrolyte balance. Adjust potassium replacement based on the blood levels. 4. Infuse insulin intravenously to bring down high blood sugar levels. Insulin helps to regulate glucose and ketone levels. 5. Adjust glucose carefully. If serum glucose drops below 15 millimoles per liter, consider adding dextrose to the intravenous fluids. 6. Consider bicarbonate administration if the patient's pH is extremely low. Administer bicarbonate cautiously and avoid it if potassium levels are critically low. Remembering these 6 replacement can assist healthcare professionals in effectively managing DKA, which is a serious medical condition that requires close monitoring and proper medical management to ensure the best possible outcome for the patient.